Hello everyone, I'm Shahd Mutaz, and today I'm going to be explaining the symptoms or the reasoning behind the symptoms that we can see in a lesion of the genu of the internal capsule. Now, this is supplied by the ACA, so if you have an occlusion of the ACA artery, then you're going to get a lesion in the genu. Now, the symptoms, I don't want you to memorize them. Instead, we're going to make sense of each one. So first, let's start with the lower facial weakness. So to understand everything, we just need a quick overview of the corticobulbar tracts. So over here, I have a drawing of the midbrain, pons, and medulla, and in each one we have the nuclei of the cranial nerves. So in all of the cranial nerves, or in most of them, essentially what happens is that you get your fibers coming from the cortex, okay, and they're going to synapse with the nuclei of both sides. Okay, so the fibers coming from the right are going to synapse with the right and left nuclei. Okay, as you can see, they're giving both fibers. So, and on the left, it's going to come like this and like this. Okay, so let's first understand the lower facial weakness. So in order to understand that, we need to talk about the facial nuclei. And the facial nuclei, as we know, is present in both the pons and medulla. You have an upper part and a lower part. Upper part supplies the upper half of the face, lower part supplies the lower half of the face. Okay? And obviously right is right and left is left. طيب. هلا essentially what happens is that you get your facial fibers, not nerve, because the nerve is going to be coming out from the nuclei. Okay, so when I say fibers, I mean upper motor neuron fibers. And when we say nerve, I mean the lower motor neuron. Okay? So over here, when we're talking about the fibers, they're going to come and they're going to synapse with both sides, like we just mentioned, okay? So this is the right side, it's synapsing with both the right and the left. And it's also going to synapse with the lower part, okay? So this is the upper part. It's also going to synapse with the lower part. But the trick is, it's only synapsing with the contralateral lower part. Same thing is going to be applied to the other side. So this is going to come like this. This is going to come like this to both upper parts, but the lower part, it's only going to be synapsing the contralateral side. Okay, it's only supplied by the contralateral fibers. How is this significant? So if you get a lesion in this area, okay, on the right side of the brain, you got a lesion in these fibers. So what's going to happen? This is going to go, this is going to go, and this is going to go. But I'm going to tell you that actually these are not going to go. And it makes sense why, right? Because these are supplied by the fibers of the other side. So what's actually only going to be affected? Only this side, okay? So that's why when you have a lesion on one side of the upper motor neuron fibers, you're only going to get a problem in the contralateral lower side of the face. So this is the only part that's going to be affected in a lesion in the upper motor neuron. Again, this got knocked out, so this is only affected because all of the other parts are supplied by the other side. Tamam. So now we understand why it's contralateral lower facial weakness. And now we need to understand why is it tongue deviation to the healthy side. So as we know, the tongue muscles are supplied by the hypoglossal nerve, and over here we have the nuclei. So the fibers are going to come from the cortex and they're going to synapse with only the contralateral nuclei, not like this or like this. It's only going to synapse with the contralateral nuclei. So this side's also going to synapse with the contralateral nuclei. How is this relevant? So let's take a look at this picture. This is a picture of the tongue, okay? This is the left side, this is the right side. So if you have a problem in the fibers, in the upper motor neuron fibers, that means that this side is going to get knocked out. So if you get a problem in the right side, that means that the left side will be affected, okay? So if this side is paralyzed and affected, obviously if this is affected, then this is affected, صح? This side is going to be paralyzed. And you need to understand that the tongue muscles are pushing muscles. And make this distinction because when we talk about the uvula, it's a different story. So the tongue muscles are pushing muscles. So if this side is paralyzed, this normal side is going to push on the paralyzed side. So what are you going to get? You're going to get left-sided deviation. So when we come and talk about deviation to the healthy side or the affected side, we're not talking about the healthy side of the tongue, we're talking about the healthy side of the brain. So over here in an upper motor neuron lesion of the hypoglossal fibers, you're getting a lesion in the right side. The right side is the affected side. Okay, the left side is the healthy side. So what are you getting? You're getting deviation to the healthy side because you're getting left-sided deviation. Okay? And excuse the spelling mistake. المهم. Now, if we talk about the lower motor neuron lesion, this isn't relevant to our case over here, but to just understand it completely, if you're getting a problem in the hypoglossal nerve itself, so if we're talking about the nerve, that means that we are in a lower motor neuron lesion, صح? So if this side is knocked out, same concept. This is going to be paralyzed. Right side muscles are going to push. So you're going to get left-sided deviation. And you already have a left-sided hypoglossal nerve lesion. So in this case, we can say that it is an ipsilateral deviation to the affected side. But in the upper motor neuron, what did we say? It's a contralateral deviation to the healthy side of the brain, not to the healthy side of the tongue, to the healthy side of the brain. Tamam, so I hope this makes sense. So again, over here we said tongue deviation to the healthy side of what? Of the brain. And now we're going to talk about the uvula. Okay, so when we talk about the uvula, we're going to talk about first the corticobulbar fibers. So same concept applies to the uvula that applied on all of the other ones. مش زي الهايبوغلوسال اللي هو the fibers are going to come from the right side and supply both nuclei, both right and left, okay? But there's a catch, okay? The catch is that if your fibers that are coming from the right, okay, they're obviously supplying this and this, صح? They're supplying both nuclei. But the contralateral fibers are stronger, يعني they are more, يعني the dominant effect is coming, so the dominant effect on the left nuclei is coming from the right side of the cortex. Okay, that's why I made these very thick and these very thin. Okay, that means that the right side of the cortex has a dominant effect on the contralateral nuclei. And this is very important when we talk about upper motor neuron lesions, okay? So, innervation to the contralateral side is stronger. طيب, let's say we have a lesion over here, okay, on the right side. This means that this side is weakened, صح? So if the left nuclei is weakened, obviously we're talking about the vagus nerve when we talk about the uvula, okay? If the left side is weakened, so this means that this is your paralyzed side, صح? But we have the levator veli palatini muscle, and it is a pulling muscle, okay? Opposite to the tongue was a pushing muscle. This muscle is a pulling muscle, and it's going to affect the outcome, obviously. So make sure you understand this. So the uvula is a pulling muscle. So what happens over here? This is the paralyzed side. So the normal side, the muscles over here are working. Okay, this muscle is working. So it's going to start to pull the uvula to the to the affected side. Obviously, when we're saying affected side, I mean the brain, not the uvula. So it's going to pull the uvula to the affected side, which is the right side. Okay, I hope this makes sense. But this scenario is essentially what is written over here. Deviation of the uvula to the affected side in a upper motor neuron lesion. Tamam. Now let's talk about the uvula in a lower motor neuron lesion. Again, this is not relevant to this scenario, but just so that you understand the full picture. So if you have a problem in the uvula, in the vagus nerve, let's say your problem is the right vagus nerve. So this side is going to be paralyzed. So what's going to happen? These muscles, the levator veli palatini muscles, are going to pull the uvula to the contralateral healthy side. So this is the healthy side, صح? This vagus nerve is healthy. This vagus nerve is knocked out. So you're going to get contralateral deviation. عشان هيك هذا اللي لما قبل شرحناه حكينا إنه this is الuvula كذابة, opposite عن الhypoglossal nerve. If you get a hypoglossal nerve lesion, you're going to get ipsilateral deviation. And عموما, in all of the lower motor neuron lesions, if you're in the cranial nerves, you get an ipsilateral deviation or ipsilateral lesion. بس الuvula هي كانت الكذابة. ليش؟ لأنه it's going to the contralateral side, to the healthy side of the vagus nerve. So I hope this makes sense. Please feel free to reach out if you have any questions, and thank you.